Hi, I'm Josh Jacob, consultant orthopedic surgeon. This is my colleague Ash Unithan. Thank you for tuning with us. Now today we'd like to speak about having a total knee replacement. Now if you followed the previous video about a total hip replacement, we were giving you a big rave about the success of a total hip replacement. A knee replacement is again a successful procedure, but let's be fair, it's not as easy to cope with after the procedure. Now tell me, Mr. Unithan, who gets a knee replacement?
So, majority of the patients who get knee replacement are secondary to arthritis. Now, arthritis can be osteoarthritis, which is wear and tear, or rheumatoid arthritis, which is an inflammatory condition. You might also require a knee replacement after you had injury or trauma and had fractures, and the fractures have healed, but that has caused you to have secondary arthritis. These are the main reasons why one would have a knee replacement. There are lots of other conditions, but these are the main reasons why in our day-to-day practice what we give a knee replacement for.
And if you remember from the hip replacement video, Mr. Unithan mentioned that all these replacement procedures that we do, we're doing it primarily because you've reached the end of the tether. Your knee, remember, is the best knee that God has given you. We can't in any way, shape or form improve on it, but what we can do is try and help alleviate the symptoms. So if you have night pain that is really affecting your sleep, affecting your following day, if you have pain at rest, just sitting where you are, pain, difficulty in getting in and out of a car, in and out of the bath, running for the bus, running from a bear, whatever it is.
Running from a bear?
Well, in upmarket Surrey, you may not find a bear. Those are the conditions that you would expect to come to us, and we'll counsel you whether you would benefit or not from a replacement. Remember, you should have exhausted all forms of non-operative treatments before you allow your surgeon to slash you with a knife. Now, is there anything that a patient can do to improve the effectiveness of a knee replacement? Things that you can do in the run-up to the procedure?
So the important thing, as I said in the hip video, is that you are preparing yourself for a 100 meters race. So the pre-optimization, especially for knee replacement, is very important. So the pre-optimization includes strengthening your quadriceps muscles. And I cannot emphasize more on strengthening your quadriceps muscles. I'm sure I do that, I'm sure Mr. Jacob does that. We routinely tell patients that they should go on an exercise bike, or in my case I like spinning, so go spinning, though I'm sure I don't look like somebody who does spinning on a regular basis. Thank you, Mr. Jacob. But spinning or exercise bike, which help you to get your quadriceps muscle working and strengthening, is very important. Second would be weight loss. Any amount of weight loss helps because it helps the recovery period, and things like swimming, aqua aerobics really makes a difference. And what is most important is mentally prepare yourself that the next 6 weeks to 6 months are going to be very tough. Do you agree on that?
Absolutely, yes. And also, in order to expedite wound healing, we often advise our patients always, in fact, to stop smoking or cut it down as best as possible. Avoid shaving the operative site because shaving increases the risk of infection, and ideally we give you a chlorhexidine pre-wash. It's an antiseptic wash that helps to again minimize the number of bugs that colonize around your operative site. Have a plan in place before, during and after the replacement. We'll take care of the plans during the replacement, but before and after, it's best to get your family involved, maybe even your doctor involved, and try to set things in place so that the knee replacement goes as smoothly and efficaciously as possible. So, yeah, you were saying.
And speak to other people who have had knee replacements, and so they understand. So you get an understanding of what you're expecting when you come home, and also mentally prepare yourself for the surgery. I always tell patients 50% is our job, 50% is your job in a knee replacement. Do you agree on that?
Absolutely. In fact, I tell them I can put the engine, but I can't change your tires. And the tires are your muscles, your ligaments that are functioning. So if they are functioning before the procedure, they will have to function after the procedure with your persuasion. But if you haven't actually put them to good use before the procedure, then we are not miracle workers. We're basically glorified carpenters,